Hi, my name is Doctor. In this presentation we will describe the basic anatomy of the liver, how blood flows through it, and how disruption of this anatomy can lead to liver pathology. Nurse Kevin, I would like to review the anatomy and blood flow of the liver before we perform this patient's transplant.
That sounds great, doctor.
The liver normally resides in the right upper quadrant, mostly tucked under and protected by the rib cage. This patient has an enlarged liver due to an hepatitis C infection, so his liver is palpable below the rib cage. We will be extra careful during this operation, even though universal precautions apply to everyone.
It's okay, doctor. I already have hepatitis C from sharing needles in the 70s.
That is unfortunate, Nurse Kevin, but you should pay extra attention since you will be having this operation eventually.
Yes, doctor.
The liver is divided into 4 lobes, Nurse Kevin. Can you name them?
Right, left, middle, and little.
I'm sorry, that is not correct. The 4 lobes of the liver are right, left, caudate, and quadrate. What important digestive secretion is formed in the liver?
Why, that would be bile, of course. It is stored in the gallbladder, which resides on the inferior aspect of the liver.
Excellent. Can you tell me the basic structural unit of the liver, Nurse Kevin?
The lobule is the structural unit of the liver, doctor. The lobules are basically cylindrical structures that are composed of hepatocytes and ducts. In the periphery there are triplets of vessels that include an hepatic artery, hepatic portal vein, and bile duct. In the center there is a central vein. Blood flows from the hepatic artery and portal vein in the periphery into the central vein through sinusoids.
Excellent, Nurse Kevin. How are the hepatocytes organized?
The hepatocytes are organized into linear arrangements of simple cuboidal epithelial cells that line the vessels.
Good job. So where does the blood come from that flows through the lobules of the liver?
The liver is part of the portal circulatory system. Deoxygenated nutrient-rich blood from the gastrointestinal system is transported toward the liver via the superior mesenteric vein, inferior mesenteric vein, and splenic vein. These veins converge into the portal vein. The portal vein, along with the hepatic vein which carries oxygenated blood, transports blood into the lobules of the liver. In the lobules, blood flows from the hepatic artery and portal vein into the central vein through the sinusoids that are lined by hepatocytes. Interestingly, the endothelial cells of the sinusoids have large fenestrations that allows plasma to freely exchange with the interstitial fluid that bathes the hepatocytes. This enables the liver to process the plasma and accomplish vital metabolic functions such as glycogenesis, protein and lipid metabolism, iron and vitamin storage, drug detoxification, plasma protein and clotting factor synthesis. Blood then exits the liver through the hepatic vein into the inferior vena cava.
Well said, Nurse Kevin. But if there are such large fenestrations, why doesn't fluid normally accumulate in the abdomen?
The liver has a large amount of lymphatic tissue that can drain excessive fluid.
Our patient's liver biopsy suggests he has severe cirrhosis of the liver. How would this affect fluid dynamics in the liver?
Cirrhosis of the liver increases pressure in the portal veins and sinusoids. If this pressure increases at a greater rate than the lymphatic vessels can drain, fluid will build up in the liver and eventually leak through the liver capsule and fill the abdominal cavity, resulting in ascites.
And how will cirrhosis affect blood flow through the portal system?
The portal system will be adversely affected by the constriction and hardening due to cirrhosis. This can cause portal hypertension, which is simply increased blood pressure of the portal system draining into the liver.
Excellent. How do we define portal hypertension, Nurse Kevin?
Portal hypertension is defined by 10 millimeters of mercury or greater pressure difference in the portal vein when compared to the hepatic vein.
I see. What effects can that have on the body, Nurse Kevin?
Portal hypertension can lead to venous rerouting as the body tries to lessen the pressure in the portal system. The development of esophageal varices is one of the most serious and potentially life-threatening complications of portal hypertension.
So what exactly are esophageal varices?
Esophageal varices are new growth veins that connect the portal vein with the esophagus. This is a very bad thing because they tend to rupture, and this is often fatal for the patient.
That sounds dangerous. Do you know what the treatment is for esophageal varices, Nurse Kevin?
Doctor, the treatment of choice is band ligation performed via upper endoscopy. Coincidentally, upper endoscopy is great for both diagnosing and treating esophageal varices.
Wow. Nurse Kevin, you have an excellent understanding of the liver. You should write some multiple choice questions for your classmates on this subject.